this is an interesting story. I briefly just saw, I think this all started, and please correct me if I'm wrong, UConn, University of Connecticut did a study on this. Is that where we're kind of gaining
There's
this?
a few places.
Okay, there are a few places.
Yeah.
So tell us all about it. Now I'm curious.
All right, so this is a study that is open to healthcare workers throughout the state of Wisconsin. And the idea is to try and use a relatively inexpensive, low-risk antiseptic intervention to try and reduce the risk of COVID in healthcare workers. What this means for a healthcare worker then is because we are coming into contact with patients who have COVID, one way to protect ourselves is to not allow the virus entry into the nose and mouth, which is how COVID spreads. So how can one do that? Well, this trial uses two products. One is an intranasal povidone iodine using a swab. It's applied to the inside of the nose. It doesn't have to go up very high inside the nose, just the inner side. You do that twice a day. And then there's a second product, which is a chlorhexidine mouth rinse, where you swish it in the inside of your mouth and then spit it out. And that's done 4 times a day. Together, these two products will coat the inside of the nose and mouth, and even if one were to say have exposure to somebody with COVID, the virus would die upon contact with these two antiseptics and not be able to gain entry into the body.
Wow. It's pretty interesting. You know, this worked, I believe, for like SARS and other type of top viruses that are of a concern, right? So it can kill, if it can kill COVID, it can kill quite a lot.
I think it has a lot of potential. You know, there's some lab-based studies that have tested these products against other respiratory viruses, other coronaviruses, and so for those in the lab, it seems to have promise. What we don't know is yet how well it works in humans, and so that's why this study is important.
Are you guys affiliated with any other departments that are also, I know you mentioned this is for healthcare workers across Wisconsin. I didn't know if there were other places besides UW Health that were piggybacking on the study, or other states?
So really, I think the goal is to, protect healthcare workers, and so within the state, for instance, any healthcare system, healthcare workers who are part of anywhere in the state can participate in the study. There's a website that you would go to sign up and then express interest, and we would mail the materials to you at no charge after you consent to the study, just like a conventional clinical trial.
How cool. And this study currently underway, are we still recruiting? What's all that looking like right now?
We are still actively recruiting. We've had a lot of interest from many healthcare workers, but we would like to recruit as fast as possible so that we have an answer to this question. If, as we expect, this intervention works, then it has enormous potential, not just for healthcare workers, but any setting where people are getting together, such as schools, for instance, nursing homes, and other settings. So in order to do that, we first have to show and answer the question, does it work? And to do that, we need to do this trial as quickly as possible.
How many would you like to be involved in the trial?
So, the more the better at this point. I think we're looking for at least 100, but closer to 500 would be more advisable.
And what do we have right now on numbers?
Right now we have about 60 or so people who have expressed interest, and out of those, 10 are actively participating in the trial.
Exciting. What about families? I'm just thinking about healthcare workers and maybe their families want to participate. Is that something that you'd want to pursue at this point, or you really want to keep it strictly for the healthcare workers?
So at this moment, the inclusion criteria requires that you're a healthcare worker. Down the road, though, and again, I think this depends on what we find, if it works in that setting, then there's no reason why it can't be used by other people, such as family members.
So these solutions that you're talking about, like iodine, I'm just curious how that works in the system, and also speak to, are there any people that should maybe not be participating? I don't know if you're pregnant or if you have thyroid issues or things like that you would be concerned about.
So these are, low-risk antiseptic interventions. They don't get absorbed by the bloodstream. They don't go into the rest of the body. So the risk is pretty low. The people who shouldn't use either chlorhexidine or povidone iodine are those that are known to have an allergy to one or both of these substances. But beyond that, if you can apply povidone iodine in your nose and do a mouth rinse with chlorhexidine, there's no contraindication to it.
Excellent. People are going to watch this at home, and they might not be a healthcare provider, but they might want to, at this point, if someone at home wanted to try to do this too, what would you say to them,
Well, I think it's very tempting. We're all looking for things to prevent transmission of COVID-19. But as we've learned from some other things that potentially seemed promising, you only want to try things when you know that they work. And so for this to be widespread use, I think we first have to demonstrate that it works. Because if it doesn't work, you're spending a lot of money for nothing.
Absolutely. You know, I remember when the oh gosh, what is her official name? Not Duchess Meghan Markle. Her official name. She would travel, whatever her name, or whatever. Anyhow, yeah, the princess. So anyhow, when she would travel, she would use Vaseline in her nose, and she would coat her nose with Vaseline because she swore that like would keep you from getting anything, any viruses or anything that would get lodged there. Is that kind of a similar idea here? If this works, might you try, or maybe be trying other items, if this doesn't work?
Yeah, I think that's hard to say. I mean, Vaseline, what it is doing is it's making the inside of your nose a little more moist than it would otherwise be. Like when you're traveling, you get dry nasal passages. But it doesn't have any antimicrobial properties. It's not actively killing any viruses. These agents are antiseptic, so they are actually killing microbes, including viruses and bacteria in the nose and the mouth, and that's why they're potentially more attractive than anything else.
Do you feel for this study that you'd like it done as soon as possible? Is this a study that you feel like results may not be back from it for another year? What are we kind of looking for a time frame?
I think ideally we'd like to have something that we could potentially have in our therapeutic and preventive armamentarium sometime by mid-fall. So given that, COVID is pretty widespread, we expect that the sooner we can find an answer to try and combat it, the better.
Absolutely. And how long would you like these healthcare providers to be doing this? About a month, 6 weeks? How long
for
will
each provider that is part of the trial, what they would do is they would take the active product, meaning the povidone iodine and the chlorhexidine, for 3 weeks, and then we would follow them for an additional 3 weeks when they would not be using the products, so that we can compare the results of using it versus not using it. So every healthcare worker who participates will be using the active product, but just not for the entire 6-week duration. 3 weeks with the product, 3 weeks without it, and a couple of weeks bookending to follow them to see how they're doing.
Now, I'm just curious, these are antiseptics. Are you hearing any pushback? Are people like, oh, it smells so bad? I don't know if I've ever really smelled iodine. I haven't even opened this bottle yet. Are people giving you any pushback? Or are people like, no, it's not so bad. If this works, I'll keep doing it.
We haven't really. I think the main thing that people have asked questions about is, do I really have to apply the one in the nose twice a day, and do I really have to do the rings 4 times a day? And it really, in order to have this intervention the best chance of working, I think the 4 times a day is important, because anytime you eat or drink, the antiseptic will be lost in the mouth. And so you want it to be there most of the time, which is why the 4 times a day recommendation is there. The other reason I think that people are not asking these questions about tolerability is because both povidone iodine and chlorhexidine have been used in healthcare for decades. These are not new products. Patients use them before surgery to reduce the risk of infection. We also use them in the ICU to reduce the risk of pneumonias. So they've been around for a long time, and we know a lot about their profile and their safety.
I remember reading, this is not on the fluoxetine, but on the iodine, that you can take some of it and you can turn it into, like a small percentage of it from this 10% bottle, and turn it into a mouth rinse as well. At least that's what some institutes are looking at. Is that something that you guys might be pursuing as well in the future?
I think in the future, I think it depends. If we find that this particular combination works, then I think that's what we would pursue, to get this into the hands of as many people as possible. If we find that it doesn't work, and it's a trial, so we don't know the results yet. If we find it doesn't work, then I think it's worth exploring other possibilities.
And as you mentioned, these are pretty common items. For this, I think I paid $10 for like 4 bottles, which was very affordable. But fluoxetine, forgive my ignorance, I have no idea. Is that a relatively easy to find item that could be brought out to the public?
Yeah.
Okay.
So it's over the counter. It's easy to find. It's used commonly in dental offices, for instance. After you've had some dental work, they might recommend you rinse with chlorhexidine. So it's a very ubiquitous, commonly used antiseptic.
Absolutely. I'm trying to think, your heart right now is just hopeful that this works, right? I should ask you, I always like to end like that, but, what is your heart hope for something of this undertaking?
Well, I think we're excited about the potential. The fact that it works in the lab means that there is a chance that it works in humans, and that's what we really want to test as speedily and quickly as possible. So we have yet another way to combat COVID-19.
Oh, I probably have plenty with that. Guys, anything you can think that I forgot to ask?